Hello, everybody, and welcome to another episode of Resiliency Radio. I'm your host, Dr. Jill, and with each episode, we dive into the heart of healing and personal transformation. Join us as we connect with renowned experts, thought leaders, and innovators who are changing the way we look at medicine and heal patients. Hopefully today you'll feel empowered with the information that we're presenting. I know one of the things that's been on my mind is the mental health of the U.S. and the prescription rate of things like SSRIs like Prozac is up 400%, if that doesn't tell you a little bit about the state of things. And so today I am super excited to introduce my guests, and the solution that they've come up with is really, really an innovative, amazing thing. The title of our talk today is New Insights into Mind-Body Medicine. Let me quickly introduce our guest, and then you'll hear from each of them. Dr. Achina Stein is the clinical director of the Healing Depression Project. That's what we're going to talk about today. She's a leading expert in functional medicine psychiatry and a best-selling author with 30 years of experience helping people recover from depression. She's a board-certified psychiatrist, a distinguished fellow in the American Psychiatric Association, a certified practitioner in the Institute of Functional Medicine, and a former clinical assistant professor of psychiatry and human behavior at the Warren Apert Medical School of Brown University. Her Amazon international bestseller, What If It's Not Depression? Your Guide to Finding Answers, offers groundbreaking functional medicine perspectives, installing hope and providing healing pathways with those who face chronic depression. And then I want to introduce Sylvia. Sylvia is the founder of the Healing Depression Project. She is an honors graduate from Boston College and a former social science researcher at Harvard University. She pursued graduate studies in finance and business law and has dedicated her career to entrepreneurship, becoming an accomplished businesswoman. In parallel with her thriving career, she's faced relentless and chronic depression, exploring over 60 different treatments without finding sustained relief. Her personal struggle, combined with her extensive background in human transformation and mind-body connection, led her to develop a program that remarkably eradicated 25 years of depression symptoms, leaving her depression-free. I am so excited to hear about this project because it really is one of a kind. It is going to change the face of how we treat depression and mental illness. And I think I'll ask you, Sylvia, to start of how did this happen? Tell us a little about your own story, Sylvia.
Hi, Jill. Thank you. Well, very long story because it was a long journey of 25 years, really trying to find relief from depression symptoms. I tried initially all the conventional approaches, pharmacological approaches. They didn't work for me in a way. They made symptoms worse and brought up actually new symptoms that I didn't have before trying these medications. So very discouraged, but I didn't stop there. I try also, less traditional approaches and went to countless programs, some of them residential. I also did retreats, try basically everything that was possible. As you just said now, more than 60 different treatments and programs, and nothing really worked. I could not find sustained relief. I mean, I will feel better for an X amount of time, and then symptoms will just reappear. They will come back, any day. And it was this constant cycle. And during all that process, I had moments that were like really difficult because some doctors, and that's one of the messages that conventional psychiatry delivers, is that there's no cure. So some doctors, they just advise me right in my face, just, give up this search. This is affecting you more. Just accept what it is. This is part of your life. This is part of who you are, and learn to live with that and give up. So that during those moments, it was really difficult, but I still continue because just the thought of having to live with this for the rest of my life was just, I couldn't have that thought. I'm like, no, there's got to be a way out. I knew other people have done it. I'm like, this is not going to be my story. So I continue with that. And I think what really started to make a change in my life was when I finally made the connection between physical health and mental and emotional health, which I did it on my own because none of the doctors and health professionals or therapists that I saw ever address that. It was, not part of the conversation. And when I started doing that, I really focused on my physical health first. And then that was the foundation of improving, my mental and my emotional health. And in that process, I had a few breakthroughs that included also just lifestyle habits, the lack of integration that I had. I had a lot of information, and I think people that are listening, they relate to this, that we know sometimes what's good and what should we be doing. But then the real question that I asked myself was if I was really doing that on a daily basis. And I mean, the answer was no. So I really concentrated on integrating these things that were helpful to me, like exercise, meditation, and a lot of other things. And the other thing is that I fully concentrated on it. I spent a whole life trying to heal on the side. Just, okay, 1 hour a week to do this. Then I'm going to see the doctor like once a month. And then I'm going to listen to a podcast, every so, or whatever the situation was, but always in the middle of the chaos of life and never really given it the necessary time and attention. So when I did that and fully concentrated on that and put together the pieces that I mentioned before, I ended up putting a program just for myself. That was never my intention to do this program. I was on a survival mode and just trying to feel better and stay better. And the program worked incredible well for me. I've been feeling fantastic almost for the last 5 years. And, about 2 years ago, I really got inspired and the feeling of this could help others. And I joined efforts with amazing doctors such as Dr. Stein here with us.
Thank you for sharing your story, because story is really, I love starting the podcast with that, because it's often someone who encounters a problem that can't be solved by conventional medicine. The story is the same over and over. And even though we have wonderful conventional tools, and I want to hear from you next, Dr. Stein, especially in the field of psychiatry, that is not always the answer. And there's a place and time for medications, but there is so much more. Dr. Stein, you are a true expert, and you've written a very successful best-selling book. How did you connect with Sylvia, and tell us a little about your background, and first even just getting into medicine and psychiatry and then getting aligned with this particular project?
Yes. So I've been a psychiatrist for over 30 years. And when I practiced traditional psychiatry, did psychotherapy with my patients as well. There's some psychiatrists who don't do psychotherapy, but I was trained to do that. So I had a combination practice. And being a DO, I was already of a holistic mindset. So I did spend time talking to my patients about sleep and exercise and movement, and eating right, things like that. But I didn't do it to the degree that I do now, once I became a functional medicine doctor, or now psychiatrist, specifically for mental health issues as well. Until 2010, my son actually had an acute mental health crisis. Here I am, a psychiatrist. And overnight, he became acutely depressed and standing on a fifth floor ledge, ready to jump. And this was an overnight change in him. There was no signs of it happening. And as a result, we obviously, I'm shocked. Why did I miss it? How did I miss this? But we ended up having him see a psychiatrist and a therapist. He was on 4 medications, and for lack of a better word, he was a complete zombie. He was not my son.
Yeah.
And I couldn't understand why it happened, how it happened. And I felt like it was a neurological problem initially, not having that functional medicine bent yet. But I just didn't want to stop there. I didn't, even though doctors had said, well, you have depression on both sides of your family, in your history, be glad that it's just one of your 3 children and not all 3. And that just wasn't acceptable to me. The thing about him was that he was also overnight not able to read anymore. And this is why I thought he was having some kind of brain issue. he had significant double vision. And so that's why I went down that route. And all they were able to tell me was that it was, oh, just give him some exercises, eye exercises, and that'll get better. It's like, no, there's something wrong. There's what's going on in his brain. Unfortunately, I was able to cross paths with Ed Levitan. And at that time he was CEO of Visions Healthcare in Massachusetts. He and his wife Wendy Trudeau, who you probably know, who's a gynecologist. The two of them now have a practice called Five Journeys in Massachusetts. But at that time, it was Visions Healthcare. I took my son there after asking him, and I didn't even put it together. I was so interested in functional medicine and alternative health that I asked to shadow him for a period of time and just understand what it is. And sure enough, like, oh my gosh, I have to bring my son here. And it ended up being that he had celiac disease. He was highly malnourished. So very nutrient deficient as a result of the celiac disease. And he was found to be very sensitive, not just to gluten, but also soy and dairy. And so just from that, he was able to resolve his lifelong history of constipation and eczema, just those three change, just the change in the diet, that he felt significantly better and was completely on board with the rest. So imagine a 14-year-old kid being on board. So he did all of the 5R approach, gut restoration, and was able to come off of all the medications and be very happy, vibrant, and feeling even better than before this all happened. So it took about a year to 2 years for him to get completely resolved in terms of even the diplopia, the double vision, because the cranial nerves of his eyes were inflamed. But it didn't, I think, if I remember correctly, it was about a year before he came off all the medications. So if you can act quickly and address these issues, things can get better pretty quickly. And I'm glad for the medications initially because it stabilized him, but he was having so many side effects. But once I saw the power of functional medicine and also seeing not just in my son, but all the patients that I was witnessing getting better, by shadowing Dr. Levitan, I just had to go all in, and I was a sponge learning functional medicine. And I've been in practice since 2012. I actually started working for his practice. I left my medical director job to join his practice, and then started my own practice called Functional Mind in Providence, Rhode Island. And so when I met Sylvia, it's like, yeah, I mean, what you're talking about is what I do with all my patients on a one-on-one basis. And it is about doing all the things all at the same time and habit stacking those lifestyle changes. But it starts with diet. And I don't think Sylvia emphasized it. It was the diet, starting with diet, that made a big difference for her. And then also stacking on a daily basis the habits of exercise and meditating and breath work. And, I'll let her go into the rest for her. But I think it's really important to emphasize that it is doing all of the things all at once that's going to make symptoms like depression, especially a treatment resistant depression, treatment of what is it resistant to? Pharmaceuticals. Right. It's not resistant to other things. And there's so many other treatments out there, so many.
Well, I'm excited to dive into some of that, and also just the program you guys have created. One thought as you describe your son is, I'm sorry you had to go through that, but what a beautiful way for you to be able to transition, not only help your son and change his life, and now all the many, many thousands of people that are getting help by what you've already done, and now this new project. Another thing just for our listeners, I think is so interesting is celiac disease and non-celiac gluten sensitivity. We most often think as a gut disorder, which it definitely affects the microvilli in the gut. But in my experience, and I think the data holds us out, about 50% have gut symptoms of diarrhea, malabsorption, and all of that, which was contributing. But about 50% have insomnia, fatigue, and depression or anxiety. So the mental health part of celiac, I don't think we talk about enough. And it's just profound. I had a funny experience last year in Australia. I'm celiac, gluten-free completely. And for some reason, I went to this little health food store, got this. I don't usually ever eat bread, but it was what I thought was gluten-free bread. It was not. So for 3 mornings, I had this bread. Now, my gut was perfect, which is actually a testimony to how I've healed. No problems. But about 2 hours every day after I had like organic honey and this kind of toast, I would get the most dark depression, grumpy, and that's not me at all. And by the third day, I'm like, what is going on? And then I looked at the label and I see spelt, which of course is a gluten containing grain. I'm like, well, this I guess is what happens for me when I get gluten exposed because it had been like 20 years and it was all brain. And had you not known, it would have been, it was a temporary kind of depressive symptom. So I completely experienced that for myself. As soon as I got the gluten out, I was fine. But it's so interesting because it really does affect the mind. And I think many of our listeners may not know that food affects the gut and the brain. Sylvia, do you want to comment on the dietary changes and like how profound that you found food was at the core in the beginning of your process?
Yes. So I think like there's like so much research showing the link between nutrition and mental health, and it's still like conventional psychiatrists, they don't talk about it. So it was just out of like just listening to different things and trying different new things, and I changed basically everything that I was eating, and I started cooking as well, because I wanted to make sure, like, as you were talking in your story, what ingredients are inside. So I stopped eating processed foods, or if it came in a bag or a package or a box, that was a no. And I went to like, Whole Foods, and I started to really kick like sugar out, and carbs. I was eating like the small amount of carbs and only once a day. So just making like those changes that made me feel like so much better. For example, another thing that I did that was very powerful was fasting, intermediate fasting. And in my case, I was doing it for like, sometimes 16, 18 hours, and sometimes even more, because as I started seeing the benefits, I thought of, okay, my body is like kind of like cleaning itself, and let's give it the time to do that. And I started like reading about it. I really loved the whole concept. So that just not eating all the time and not adding sugar and processed foods change my energy levels to a point that I was then able to implement the other things, because I was experiencing so much fatigue and energy drain that just thinking about doing any other change in my life was no, I can't. I'm doing, the most I can. So that was definitely one of the pieces that was a complete game changer. And then this is one of the reasons why I'm also doing the project, because I cannot believe that even now, with so much research showing this, still doctors don't talk about it. And if they mention it, it's like kind of an afterthought, like at the end of the consultation, or like, yeah, eat healthy, or, just something after they're prescribing, of course. And so it's when that's the approach, that's the fundamental, like for healing. Like if you fix the way your metabolism is working, and that any like metabolic dysfunction that you have in your body, which is what we're doing with the nutritional psychiatry that we're doing, then that's the beginning of sustained healing.
I love that you're talking about food as medicine at the core, because it really is such a foundation. I want to hear from you in a moment, Dr. Stein. And as you describe that, one thing that people may not know is I've been teaching a while on the gut, and of course, LPS-induced endotoxemia, which is this coating of gram-negative bacteria in our gut that sneaks across from the gut lumen into the bloodstream. And if you start to search and look at conditions that are associated with this endotoxemia, which we all have to some degree after meals, but I'm suspecting it's much larger in our depressed populations, because there is studies linking elevation of endotoxemia and depression, and elevation of IL-6 and depression, and these are all connected. So it makes sense when you talk about fasting, because that's one way to give your body a break from that internal toxic load. And it's so, even if we don't even know what's happening, we're like, there's something good. I always find in clinical practice, patients, if they say, you know what, if I just didn't have to eat, I'd feel better. I know there's some degree of leaky gut endotoxemia happening. And on the list of things that it causes is depression, anxiety, insomnia. Dr. Stein, do you want to talk about the gut, the food, and maybe just give us a flavor of why in medicine, because we're really not taught a lot about nutrition. And that's what Sylvia is alluding to. In functional medicine, we learn its core. We have to relearn all the core principles. But in our traditional training, most doctors aren't taught a lot, are they?
No, they're not taught very much at all. And although they know on a superficial basis that eating healthy is a good idea, they don't necessarily see that it could be a driver of treatment in terms of the actual diet causing, like a poor diet causing depression, or poor diet causing mania or anxiety. That those connections are not made. I kind of find it mind-boggling nowadays. Now that you know what you know, that there's still such a big disconnect. But there are books coming out about that from functional psychiatrists like Dr. Georgia Ede, Change Your Mind, Change Your Diet, Change Your Mind. And Dr. Christopher Palmer's book, Brain Energy, that is both leaning towards the ketogenic diet as being a way of treating depression specifically, and also anxiety and bipolar and even psychotic disorders. So, and the ketogenic diet, I'm sad to say that people don't really understand what that is. They tend to associate it with meat, but it really is a low carb diet. It's bringing carbs down, and it's a clean diet, removing sugar and ultra processed foods, eating whole foods, and reducing carbs significantly. There's actually a vegan ketogenic diet. There's a woman whose name that's escaping me right now, who wrote a book, and she lives in Massachusetts, who wrote a book called Vegan Keto. And so it doesn't have to be meat. It's really all about lowering carbs and eating the rest of those foods as healthy fats and healthy protein.
Thanks for clarifying. So let's move on to what else is kind of core in a functional approach. And maybe I'll go back to you for just a moment, Dr. Stein, and then Sylvia, I'd like to hear kind of your experience. But how would you outline for us, what would an integrative approach to depression really look like a map for those people who are wondering, what do I do?
Well, I mean, it's looking at food first, foods, infections, chronic infections. You mentioned lipopolysaccharides, foods, infections, toxins, stress, all of which can affect your hormones, particularly cortisol. So I look at those five, and fortunately, that a good mnemonic for that is SHIFT: stress, hormones, infections, foods, and toxins. And it's really doing a deep dive in all of those areas after getting a really detailed history to know where to point to first. But I always start with diet. And then do testing. We want to test, not really guess, as to what's going on in the body, to replace what's been missing as a result of all the inflammation caused by the problems in the body. Remove whatever's causing the inflammation after looking at the detailed history, replacing what's missing. We want to re-inoculate the gut microbiome and repair the gut lining. And after that, it's really looking at how do all the pieces of the puzzle fall in terms of what's left over, because everything really starts in the gut. So looking at mold, toxin illness, looking for Lyme, looking for co-infections to see if maybe we've missed something. Viruses tend to be missed, parasites tend to be missed, but it's doing an overview again, coming back to the board and seeing if, okay, what else is there? It's because sometimes when you get a history in the beginning, people don't remember. So you have to go back to the board, the slate, and start again, and say, well, what about this? Are you sure? Are you sure your house doesn't have mold? Are you sure you haven't been bitten by ticks? So, and then maybe do some more testing. But it sometimes takes a couple rounds, but generally I find, after getting a really good history, you can really address all of the issues. And people can get well anywhere from 6 months to a year, depending on how inflamed they are. But sometimes it takes a couple years. It's just a matter of staying on top of it, being persistent, consistent with all of the recommendations, following through. The follow through is really important, staying on top of it and not losing your target, which is getting well, feeling well, and remaining hopeful.
Yes. Gosh, thanks for framing that. That's such a great outline of what we do in functional medicine. And it no surprise, applies to both the body and the mind.
Right.
Sylvia, I'd love to hear your experience. Obviously, diet made a pretty profound shift. And then what else did you find was the most helpful for your recovery?
Well, I think if I had to choose, would be sleep. Sleep was something that I didn't prioritize, and I didn't have like a good a sleep hygiene. And that was something that I really concentrated on, just when I was doing the program for myself at 9 a.m. At 9 p.m. sorry, I will shut down everything in my house, like TV, the lights. I will have like a sleep routine, and I would just be in bed even before 10, and started like building that habit of of sleep, and choosing sleep versus like staying late, like watching another episode of the series, or just on social media, or whatever else is it that that we're doing. So that the sleep piece really changed a lot of things for me, and together with exercise, movement, just that was something that I thought, and this is that I couldn't do because of how bad I was feeling and how like little energy I had. And and it's actually, I keep thinking, like, for people with depression, then there's all these symptoms that are really affecting any positive change, to create any positive change in your life. Because when you're going to start something new, you need motivation, you need hope, you need physical energy, because like otherwise you're not gonna, like, how are you going to do that, and how are you going to stick to it? So in my case, I really had to push myself to do those things, because I always had the excuse of like, I feel I'm too sick to walk, I'm too sick to go out, I'm too sick for this. And I guess when I stopped that conversation and I really said, I can't wait to feel better to do those things, because those things are the ones that are going to make me feel better. So when that clicked in my mind, I just started, and I started little by little. I am actually, since you love stories, when I initially began with, with this exercise, I signed up for the gym. And the gym was a 10-minute walk from my house. By the way, a beautiful walk, because I had to go across a beautiful park. So that was encouraging. And I'm like, and I signed up to a really nice gym, by the way, that I'm like, I could have a sauna after, and a lot of like motivation to go. And I started just the fact of getting ready was already exhausting. But then I managed to like get ready, put my sneakers on, and get out the door. And at the beginning, all I could do was walk those 10 minutes. I will get to the door of the gym, turn around, and go back home. So that was the beginning of that. And I'm like, oh my God, but at least it was already 20 minutes walking, and then I was getting sunlight. So it was already really good, but that was the most I can do. So this is just to encourage, like, if there's people thinking that, oh yeah, you really need to feel at your best. No, you don't. And then I continued doing that for a few days. Then one day I said, like, okay, I'm gonna actually enter the gym, And I went into the oh my God, forgot the name now in English. to walk the
Treadmill or
treadmill. Thank you. Sorry. So I went to the treadmill for 5 minutes because I put the clock. I'm like, okay, when this bell rings, I'm out of here. And that's what I did, 5 minutes. And well, just making this story short, like about 3 months ago, I ran a 10K. So you can really get out of that, but you need to like push yourself in a loving way, without criticizing yourself, just accepting where you are, but just say like, oh, I must do this, even if it is just a walk, even if it is, same with the food. It's really difficult. You're feeling bad. Yeah, we have been trained to think that sugar is going to make us feel better. That's, in every movie you see,
Yeah.
when there's a breakup, what is it? Like a big
Chocolate.
pot of ice cream or chocolate. And that's the solution. That's going to fix how you're feeling. They don't show what happens after, because at the moment you get this sugar spike that might make you feel a little better, but then it comes down and is worse. It's almost like a hangover from sugar. So just doing those changes despite the fact that you don't feel well. And that was my main breakthrough, just being able to do those things despite how bad I was feeling during many of those days.
Mm-hmm.
Sylvia, thank you so much for sharing that, because I think those who are listening and suffering from depression, it's really important to hear. It's not just like boom and you feel better. And it's like you mentioned, Dr. Stein, it could be 6 to 12 months, sometimes even longer. And a couple of things came out as you were talking, Sylvia, that I think are important. One is identity matters. And so if we believe that we're sick or depressed, and we believe something about ourselves like disabled, and there's nothing wrong with any of those things. I've been very sick myself with cancer and Crohn's and all kinds of things. But if we stay in that identity, it's hard to break through. And so often the habits follow identity. So when you started to believe, I can get well, I'm not sick, or I don't have to be disabled, or I don't have to stay home, and you started to shift that identity, I feel like that was the first step even before you walk into the gym, because your identity now was, I'm going to be healthy, or I am, maybe better than even I am going to be, I am healthy in real time. And so if you're out there listening, you might write a list of things like, I am strong, I am well. I remember I started a mantra after I had my sickest days of mold, and I would walk every day and I would say, every day in every way, I am stronger and healthier, wealthier, more resilient, younger and more beautiful. I will overcome all obstacles. I will outlast all adversity. Things are turning in my favor. And I literally every day said that. And now years later, it's all been like, it's just part of me. It's who I am. And I chose what I wanted to become, and then I spoke it into existence. And I really like Sylvia, because I think some of these habits are hard, food and exercise. And then I also love, most of the time, our habits from some of the great works of James, Atomic Habits. I can't think of his last name. Right. He talks about
James Cleary.
Thank you. And BJ Fogg. Those are two of my favorites, and they're both aligned. What he talks about, though, is like, say you tag, so every day you brush your teeth. It's just a habit, right? And you might tag one push-up right after you brush your teeth. And when you're down there doing that one push-up, kind of like you walk into the gym, like, well, I might as well do two. And then pretty soon you're doing 5, and then pretty soon you're doing 10, and pretty soon you're doing more than 5 minutes on the treadmill, and then you're doing the 10K. Like, that's how it happens, and it has to start small. And it's the best way to do it is to tag it with something you already do and make it so small that it's ridiculous if you don't do it. Like me just getting ready to go to the gym. So I really love that. And I wanted to frame that because I think, Sylvia, you did such a nice job of describing your journey. And those things really, really matter. Dr. Stein, why don't you comment on what you see with patients and how to kind of shift that habit formation? Because that's at the core here, is habit formation.
Oh, absolutely. Yeah, I was just thinking to myself as Sylvia was talking that your audience is like not surprised, because like they're sitting there waiting for the magic thing that she did. It's like, oh, it was just diet. Oh, it was just exercise. Oh, it was just sleep. And like, yeah, it is those things. And it seems so little and, like obvious, but yeah, those are what really matter. And it is hard to make those changes. They're simple solutions, but they're hard to do. Really, really hard to do. I actually, when I started doing functional medicine, I worked just one-on-one. I didn't have anybody else working with me. And I found that when I gave a plan to a patient, I would see them 2 months later, or a month later, and they didn't do anything. So it's like, oh my gosh, because they were so overwhelmed by all my recommendations. Like, so then I started offering a health coach. And the people who worked with the health coach who, opted for that met their goals. They were successful. So now in my practice, I insist on it. It's just part of my treatment. You have to work with the health coach, whether you want to or not. You're going to meet with a health coach, and people are successful in meeting their goals because it's not about the plan. It's putting the plan into action. That is really the hard thing to do. And some people say, oh, I don't need a health coach. No, you need a health coach. You absolutely need a health coach. And even the people who are very, very disciplined still learn so much from the health coach because they see things in you that aren't really there right in front of you. They're on the side that's interfering in your ability to move forward. And then your success skyrockets because they're bringing it into view for you.
Yes. Oh, I love that. And I love that you're using health coaches because it really is. This is all about behavioral change, which is really much harder than taking a drug. Unfortunately, we want a quick fix. None of this is a quick fix, but it's a much, much better long-term fix. So I really love that you're using that.
Yeah. Yeah, I do want to say though that people shouldn't discount doing functional medicine. That's where the marriage of medication and functional medicine, conventional, and we have expanded our toolkit.
Yes.
It's not either or, it really is both. And there's going to be people who are so depressed that they can't get off the couch to even do what Sylvia, even though she was very depressed. There are some people who can't even function at all. And those are the people who absolutely need medications. And once they get to a place where they're stably, chronically depressed and not out of danger and not desperate, that's when you come to functional medicine. It's almost like the analogy I use is that if you've been hit by a car, right, you're not going to go right to rehab. You're going to go to the hospital. You might have surgery. You might be put in a cast for a period of time. And then there's rehab. And to me, I feel like our retreat is a psych rehab. Yeah. It's to come off the crutches of medication and have that time while you're on medication to do the functional medicine approach so that you can come off of medication and live your life knowing all the tools that you need to use in order to stay that way, to stay well. And not only will you not be depressed and anxious anymore, you're going to feel physically better as well. It's all connected. And you'll be, all around. It's not just mind, body. It's also mind, body, spirit. Yeah. It's the whole shebang. You're going to get well all across, in all areas.
That's a beautiful thing. I'm sure joint pain goes away, and the other things that you aren't thinking about are also going to improve. So thank you both for framing that so well, of the experience, what you do, Dr. Stein, and your experience, Sylvia. Thank you for being so vulnerable in that. I want to shift in our last few minutes about this Healing Depression Project, this retreat that you have put together. I am so excited and honored to have you guys talk about this. So first of all, as this is aired, it'll be starting in 2025. So tell us like the dates. You can, as this is aired, you should be able to sign up, and then just describe a bit of the program. And maybe Sylvia, you can frame, because you were kind of the entrepreneurial brains behind this. And then I want to hear, Dr. Stein, your thoughts on the program.
Yes, so we put together a 45-day program that includes a 30-day retreat in Austin, Texas, and then a 15-day daily follow-up at home for implementation and integration of all the gains that you have made during the retreat, and to really put into practice everything that has been learned. And the program includes functional medicine. So Dr. Stein is going to be with us during the entire time. We're going to be doing extensive testing before the program. So we gain a lot of time. By the time they meet for the first time with Dr. Stein, she will have the results. So that's, in some cases, even up to 4 months, which is some patients, that's how long it takes them to go back with to the doctors with the results. So we're doing all that functional medicine piece because, again, it's just asking where are these symptoms coming from and why are you experiencing this. And we're also doing those 30 days, we're doing metabolic psychiatry, which is, again, like nutritional therapy, and we're going to be doing a ketogenic diet to really address the well-being of the cell and to restore the functioning of the brain. And that's going to be during the entire program. And most importantly, it is a program that is taught as a training. So, for example, with food, then we're going to be giving cooking lessons. We're going to be doing a lot of teaching and awareness about why certain foods are bad, why certain foods are good, and what are those foods doing to you? Because there's a lot of things that we need to change in the way that we see food. So that's, there's a lot of there's a lot of that going on, a lot of workshops. And then the other piece that we're doing is lifestyle medicine, which is what we were talking about, the lifestyle habits. This is a hand-holding system in which the person is going to be able to do the things that they have not been able to do on their own. So this is like having under one roof your health coach, your psychiatrist, your nutritionist, people expert in a habits development, then your yoga and meditation teacher, all there for you during a period of 30 days. And 30 days is also the time for you to start really, through repetition, getting used to doing these habits and forming a powerful morning routine that will help you to just, feel better, and in all senses of the word. So that's what we're doing with the lifestyle medicine. And since it is very 360 and whole person approach, we're also addressing trauma. We're doing psychodrama group therapy to really try to look more for resolution, because sometimes talk therapy doesn't go all the way to resolution. Like talk therapy is good in the sense that it will bring you more awareness or light in certain issues. Then maybe you understand, oh, this is why this is happening. And then what? So this kind of therapy that we're going to be doing is to help you to try to resolve as much as possible those things that are holding you back from getting from achieving true recovery. We're also doing somatic work because, as we all know, then trauma is also stored in the body, the muscles, in the joints. For women, it's a lot around the hips. So we're helping through somatic work, just helping that trauma to also move out of the body. And we're doing a lot of mindset work. So that's through amazing meditations that are able to lower the weight in your brain so that you can access your subconscious mind, which is 95% of the mind anyways. And that's where all those limiting beliefs and all that you were talking before, Jill, they are there. Like if one of them for depression is that there's no cure for depression, or I'm going to be living with depression for the rest of my life. Even the doctor told me. So that makes it like almost like a fact. So yeah, it's a figure of authority, and it's telling you, this is what it is. And so just changing that belief, it is, as you said it before very well, that's the first step towards any recovery, feeling and thinking that you're able to heal. And so that's the work that we're going to do through meditation, kind of rewiring the brain for new thoughts and new emotions, thoughts and emotions of health, of well-being, of happiness. So, which if you've been depressed for a long time, because this program is perfect for people that have been depressed for a few years now, that have like chronic depression or the so-called treatment-resistant depression. So when that has happened for a long time, you really need to work on that mindset. So the program also does that. And finally, we touch on the spiritual piece, just kind of getting in touch with life purpose and just working on the overactive mind so that you can find peace in the present moment, building inner peace and inner strength. So it's a very, very comprehensive, and it's during those 30 days. And then basically we go back home with you in a way, virtually. So because during the next 15 days, the program is still going on. In the mornings, you're doing all the practices, like your morning routine, like all the habits. You're also taking care of the nutrition, whatever avenue you're going to take to address nutrition. And then in the afternoon, we're meeting together and saying, okay, this is the difficulties that I had. This is what I need more help with. And we're going to be there to make sure and to help you that you can integrate this, because nothing will ever work if you don't integrate it into your day-to-day life. There's no program out there. There's no good advice if it only stays in your mind. Oh yeah, I know this. No, it's not about that. It's about really becoming that, practicing that every day. So this is what the program is trying to achieve, which was, a huge change for me when I started doing these things every day.
Yeah.
That's when I started seeing a result. And it actually, even after 1 month of what I was doing, I felt completely different. And 3 months within, I honestly, biochemically, I was someone different. People that knew me were like, what happened to you? My own daughter, she said, who are you?
Wow.
And I'm like, do you notice too? She's like, oh my God. So there's the program does that, and we're only gonna run it 2 times next year. One time, the first time is in March 18. The second time is at the end of August. Only 15 people each time. So it's something, even though it has the beauty of a group and that you can get this community healing, it's still a small for you to get all the personalized attention that you need. And yeah, so my invitation is that we still have spots available for March. And yeah, super important. We have amazing scholarships, which is if you had considered at some point residential care or immersive treatments, and of course you have not been able to afford them, this is a great opportunity because scholarships cover up to 80% of the cost of the program. And so we still have those available as well. So it's perfect moment to reach out, ask for questions, and see if maybe we are the right fit to help you live your best life.
Wow, is all I can say. Sylvia, what a great job of outlining everything about that. And you guys have thought of everything. I am so excited to just be sharing this with the world because I think it's so needed. And I can't wait to see this be however many times a year with hundreds and maybe thousands of people someday. Dr.
Someday.
Stein,
Yeah.
do you want to just end with maybe a few comments or hopes for the future? I was going to ask who are the right patients for this, but it's still, Sylvia kind of outlined that. If any other comments you have about
Yeah, absolutely. I think it's important to also mention that we plan on doing research for this. Kat Toops is the research director. And as you probably know, she's done quite a bit of research with Dale Bresden in the dementia population. So, and has published quite a few landmark papers. And so we're hoping to do the same for depression to show that the functional medicine approach is the way to go for, the people who, are right for it. And it is, I really do feel that this is, in my heart, I really feel that this is the way that depression should be addressed from the very beginning, and that medication should be reserved for a small population, not 5-year-olds that are being given antipsychotic medications and antidepressants, or young children being given. It really should be food, and there's not enough being done to make the connection on a local basis. That food really ought to be first when it comes to behavioral issues, autism, depression, anxiety, psychosis, and really looking at our environment that are as root causes as well. I would imagine, because I see it every day with my patients, that if we did this on a local basis with our schools, with the public, with our towns, that most of our population would get well. I really firmly believe that.
Wow. This has been so fun to have you on, and more importantly, so exciting, because this is the future of psychiatric treatment of mental disorders. There's no question in my mind, and I'm so excited for you guys, what you've done. It's just really amazing. Can't wait to hear the outcomes. We'll have to have you back next year to talk about how the first year went and what's the next year hold and all of that. But hugest thanks to both of you guys. I think I have here and obviously with Sylvia, it's right in the back. It was great to have that in the visual. HealingDepressionProject.com. If you guys want to know more, please go visit. You can schedule a free intro call to kind of see if it's a good fit for you with Dr. Stein or Sylvia at www.healingdepressionproject.com/call, CALL. And of course, if you're driving, don't take notes. These will all be in the show notes wherever you listen to the show. And again, just thank you both so much for the work that you're doing.
Thank you
Thank
so
you
much.
for having us.
Yeah, you guys are welcome. It's been so fun. So thank you guys always for grabbing another episode here with us. And as you know, we have a new episode coming out every week. You can find all the transcripts, resources, anything else that you want to find, or show notes or web links or anything that was mentioned at jillcarnahan.com. Thanks again, and thank you both. HealingDepressionProject.com. Check it out.